Hi, my name is Heather Custard. I currently live in Virginia. I spent most of my life in Pennsylvania. I actually started my undergrad as a biology major at New York University. I spent 3 semesters there. After a while, I decided that maybe being a doctor wasn't what I wanted to do. I was really attracted to helping people and changing lives, but maybe not so much in the field of medicine. So when I left New York University to go to Temple University, I decided to apply as a social work major, and I truly feel like I found my calling. While there, I spent some time working with different programs, Jumpstart and Grandma's Kids, as well as Henry Street Settlement. When I worked with the Jumpstart program at NYU, I worked predominantly with preschool students, working on their education and the family involvement aspect of getting communities involved with children's educations. When I worked at Henry Street Settlement, it was more of an older generation of children that we were working with, getting high school students ready for their college careers, helping them with applications and tutorings, SAT prep, as well as overall guidance in what they wanted to do with their life and helping them figure out how to work through their adolescent troubles. I believe that social work is really about helping people help themselves. So the treatment that we provide, the services that we provide, the relationships that we provide are things that should be growing along with our clients. We're not made to hinder the client's growth, we're made to facilitate it. And that's a really big part of what being a professional social worker means to me. There's a certain level of dedication that goes along with being a social worker, and as I said in my essay, it's not something that everyone has. It's not something that can be taught. It is something that we're born with. It's an innate characteristic that we have, whether it's to empathize, to understand, to problem solve really well. It's all part of who we are, and I don't believe that that's something you can be taught. You can't be taught kindness. You can't be taught empathy. And those are key components to what it takes to being a social worker. When I first started my undergrad, I had really wanted to change the entire world. I had big dreams of becoming a really great doctor and just saving lives every day. And then it occurred to me that medicine wasn't how I wanted to save those lives. I wanted to save those lives by helping people save themselves. So when I decided that my time at NYU was going to be done, I got really involved with the UN club there. And my big goal was to be part of UNICEF and work overseas and all over abroad to bring fresh drinking water to communities that were in need of it, to bring education to women across the world. I wanted to attack social justice from the most macro level I could think of. And then it occurred to me that maybe that wasn't what I wanted to do either. As I mentioned before, I had worked with Jumpstart and Henry Street Settlement, and those opportunities really helped me hone in on what I wanted to do. And that was to work with children and families and small communities. I love family services. I think that the family is really where we start to fix society. So basically, my long-term goals are to work in a family services agency. Also, Child Protective Services is something I'm very passionate about, so I would love to spend some time there. And after gleaning as much experience as I could from those types of agencies, I hope to one day open my own family practice. I really think that many families could benefit from services that social workers can connect them to and just overall guidance. Not everyone needs a doctor, not everyone needs, a law enforcement agent to tell them what's going on. Sometimes they just need someone to talk to. And I think that I could provide that service. I've actually already found somebody that I believe would be an asset to my practice. She is a fellow social worker who has extensive knowledge in the LGBTQ community and would be a really great asset to the practice that I hope to open, to be all-encompassing and to be a place where everyone can find the help and services that they need. In addition to all these different things that I've done in my life and the different schools that I've gone to and agencies that I've been a part of, I also had the opportunity to participate in a research project headed by Dr. Lauren Clossie of East Stroudsburg University. The project involved the study of several peer support specialists, detailing their lives and struggles and how the mental health profession could better serve those recovering from mental illness. I had a lot of experience with this project in person-to-person interviews. We did a lot of paper surveys. We did focus groups. I had a hand in the transcription and the development of what our research was really looking to find. Our findings were actually recently published in a journal called the Social Work and Mental Health. That experience, all in all, was really enlightening for me because it gave me the opportunity to learn how to do a vast number of things in regards to research. But it also really showed me that mental illness and the community revolving around mental illness was not really something that I wanted to work with. It's not a population that I'm the most passionate about. I love helping people regardless of what the circumstances, but I realized in doing something different from what I had been doing as far as being involved with family services and children, that family services and children are really what I'm meant to do. As far as my strengths and weaknesses, I believe that one of my greatest strengths is my ability to empathize. Since I've been very young, I've been able to share the feelings of others, which has helped me to better understand my environment and how everything in life really fits together. This is a gift that can't be taught, as I said before, but will always remain the most valuable in the social work profession. It enables social workers to better serve the person in an environment and see how that environment intersects with others, which I think is one of the most important aspects of being a social worker. My greatest weakness in relation to social work is my attachment. I become very attached and invested in the people that I serve. They become very important to me. However, this is something that I'm completely aware of, and I'm constantly monitoring it so that I can make educated and objective decisions in relation to my clients and their communities. I know that it's something that I struggle with, but being able to make clear and concise judgment calls is something that is also terribly valuable in this profession. I was meant to be a social worker. I may not be able to change the entire world, and I may not have a very global goal anymore, but I most certainly will try to make a difference. And even if I only manage to change one person's life for the better, that will make it all worth it. So I hope this gives you a little bit of an introduction to who I am and what I think is really important about the world. If you have any questions or you'd like to contact me so we can talk some more, I'm sure that you could send me an email, and my phone number is 570-534-5576. Thank you so much for listening.